The changes that come with aging are inevitable. They're more than just the obvious wrinkles and gray hair. For women especially, the experience can be liberating as well as challenging. It's not the same for everyone. The physical, emotional, and mental changes may vary. But there's one very important thing, that is menopause. It's a time a woman's body, mind, and spirit deserves a lot of tender, loving care. I'm Dr. Freddy Gomez. Welcome to Med Talk Health Talk. We're here to build a healthier future for you. Menopause happens when a woman stops having monthly periods, and it's usually diagnosed when you've gone 12 months or a year without a menstrual cycle. While the average age for menopause is around 51 years old, it can happen to women throughout their 40s and 50s as well. Joining us today are specialists in healing and experts in caring. We have Dr. Maria Corazon B. De Jesus. She is the chairman of the Department of Obstetrics and Gynecology at the Asian Hospital and Medical Center. We also have Dr. Aurora Macabalug. She's the head of the endocrinology section of Las Piñas Doctors Hospital. Now, natural menopause can happen anywhere between maybe your mid-40s and 50s. Dr. De Jesus, what exactly happens to a woman's body during this time?
So what happens is the estrogen is depleted in our body. So it's parang sinasabi natin na meron tayong factory, but it is no longer producing or it's no longer functioning. And the estrogen is scattered all over our body. During the time, malapit na kaming mag-menopause, then these women will experience symptoms, most especially in the perimenopausal period. Ang mga nangyayari sa katawan nila will be the most common, which they cannot understand when it happens, will be itong mga symptoms ng hot flashes na ganun.
We want to talk about some of the changes and symptoms which can start several years early actually. So as you approach your 40s, your ovaries start to make less estrogen as well as progesterone. And these are the hormones that regulate menstruation. And at this time, a woman's fertility may decline as well. So, Dr. Awi, to better understand this process, can you explain to us why this happens?
Okay, the symptoms of menopause are basically linked to the decline in estrogen. As we know, that's our primary hormone, female hormone. No? So when it goes down, it leads to several cascade of events. Let's take, for example, sabi nga ni Dr. Cora, the most common will be vasomotor. So yung hot flashes. Why do they have the hot flashes? Because we have a thermoregulatory center in our body, which means it picks up the core temperature of our body. And the decrease in the estrogen makes this center more sensitive to the changes in the core temperature. That a slight increase will actually send messages to our brain and to our hypothalamus, and may mga cascade of hormonal changes that will lead to hot flashes. Remember, hot flashes is an event that is meant to bring down the core temperature. So maraming hormonal changes because of the reduction of estrogen during menopause.
Okay, now the symptoms can start appearing in the years or months leading to menopause, and they may vary as well. And they can be both physical and emotional. Now, Dr. Cora, what are the other more common symptoms ng menopause?
There will be night sweats, okay? So these night sweats, if it occurs a lot of times in the evening, will result into the woman na feeling fatigued. And in the morning, upon waking up, she will experience this irritability. She'll have these mood changes.
There are many symptoms that are listed with menopause. No? We have irregular periods, there's dryness, hot flashes, as you mentioned, and night sweats as well, chills, sleep problems, mood changes, weight gain, slowed metabolism, thinning hair and dry skin, and loss of elasticity of tissue. Do all of these happen to all women at the same time, or magkaiba talaga ang journey ng bawat babae when they approach menopause?
Yeah, it's actually iba-iba. Okay, so 20% of the population of women will be very lucky when that they reach menopause without any symptom at all. The majority, around 60% of women, will experience this mild to moderate symptoms. And around 20% will really have the severe ones that are really affecting their, their quality of life with their families and everybody.
It's very important to mention that it does affect the quality of life. And later on the show, we will give our viewers some tips on how to minimize the effect of these severe symptoms. But for now, we want to talk about how during menopause, many women experience actually weight gain, especially around the abdomen. Now, Dr. Awi, what basically causes this, and how can women approach this with a better understanding of maybe how to avoid it in general?
We have to understand first that it's not so much of the weight gain, but actually the change in the composition of the weight. We lose the lean mass and we gain more fat, especially around the abdomen, no? So yung ating visceral fat. It increases with aging, it increases with menopause. So more of the composition. So is this an eventuality? Is this a thing that we cannot escape? Okay, aging, we cannot escape that. So the hormones that come along with aging, we can't escape that. Knowing that the reduction in estrogen coming with the menopause may actually affect the change in compensation, then looking forward, we know that we will be going to menopause. Then we will have to be ready for it before we reach it. Meaning, we have to prepare with a healthy lifestyle, with the proper diet early on.
Another thing, Dr. Awi, is the thinning of the hair. Is this something that women can prevent, or is this part of menopause that will happen to most women?
Yes, that is a common occurrence, again, because of an imbalance in your androgen and estrogen thing for the conversion and everything. So that's the reason why older women experience baldness. Okay, maybe not as overt as men do, but there is some thinning in some parts of our hair. Okay, so that is a common occurrence. Again, normally women do not have a bald patch. We normally don't have that, but we do experience thinning as we approach menopause. We start about perimenopausal, around the menopausal transition to postmenopausal. So we do experience thinning, we do experience dryness of the skin, dryness of the hair. So that is very common with menopause as well.
Okay, so it's important that our viewers know some of the processes that they may experience when they approach menopause, because it is a natural process and it occurs in all women starting in their 40s and their 50s. Not everyone may welcome it, but it can be avoided. When we return, what are some things that you can do to make your experience somewhat better? You're watching Med Talk Health Talk, your partner in healthcare, right here on CNN Philippines. Welcome back to Med Talk Health Talk. I'm Dr. Freddy Gomez. Now, menopause is not a health problem. However, it can involve some unwelcome physical as well as mental changes. So if you are concerned about any of these changes, it is best that you talk to a professional, to your obstetrician or your endocrinologist. Now, when we talk about treatment for menopause, it's about treating the symptoms that disrupt your daily life. Dr. Awi, what are some of the available treatments for menopause symptoms?
So we have hormonal, we have non-hormonal. It will depend basically on a symptom that the woman experiences during menopause. Because as you said, menopause is not an illness. So that's not something we need to cure. But we need to address the symptoms that may come with the menopausal stage. So it will actually depend on the profile of the woman. We do have hormonal therapy, and that's the most effective. But for those who are not candidate for those, when we say hormonal, this is the use of the estrogen, progestin, the hormones, female hormones. No? So that's the most effective to address these hormonal symptoms, these menopausal symptoms. And then we do have the non-hormonal ones. When we treat, though, we have to profile our patients about the history of cardiovascular disease, about the history of stroke, history of embolic events. Basta basically, is there something that will contraindicate this woman into using the hormonal therapies? Because if she does, then we may opt for something else. Again, that will depend on the symptom of the woman.
Now, while hormone therapy helps ease a woman's symptoms during menopause, it's not risk-free. Dr. Cora, what are some of the risks that may be present when undergoing hormonal therapy?
The significant changes that occurs after menopause, no, will be number one, osteopenia or osteoporosis. Okay, because bone demineralization of bone turnover occurs early. When we are 30 years old, up to the time that we are menopause, there will be a bone turnover, so that the woman is at risk for fractures if she is not careful. The second one will be our increase in the risk for cardiovascular events. And then urogenital symptoms, which are current vaginitis, inflammation of the vaginal walls. We call it atrophic vaginitis, which progresses up to the time the woman gets older. Okay. So these are the things that we want to emphasize when they come for checkup.
That's very important indeed. I'd like to ask this one to Dr. Awi. Dr. Awi, with those conditions that Dr. Cora mentioned, is there a way that the woman can do in order to prevent some of these conditions?
These are conditions that may go hand in hand with menopause, so some of them we may not be able to avoid. However, to prepare for menopause and it's the possible conditions that can come after menopause, like what was mentioned, cardiovascular disease, for example, osteoporosis, even dementia is increased during menopausal stage. So what we can do before we reach it is to embank on a great lifestyle. Okay, exercise, proper diet, mindfulness, so that those things will prepare us to avoid or developing these conditions. So we do target, again, those who are less than 60 years old on menopause for less than 10 years. So those who have been on the menopause early on.
Okay,
or in the early stages.
Very good advice, because a lot of changes really happen in a woman's body because of menopause, which means you should also make changes in your lifestyle, hopefully sooner rather than later. More on this when we come back. We want to be your partner for a lifetime of good health. This is Med Talk Health Talk on CNN Philippines. You're watching Med Talk Health Talk on CNN Philippines. Today, we're talking about menopause, which marks another chapter in a woman's life. While most of the menopausal symptoms are naturally occurring, they can be uncomfortable and can change your quality of life as well. I'm Dr. Freddy Gomez. Changing hormone levels during menopause can affect your mental health, and this can increase your risk for anxiety as well as depression. Dr. Awi, what are some of the tips that you could advise women who are premenopausal or who are close to that phase of menopause? What can they do to improve that transition phase?
Okay, so age is a number that will remind us that we're always approaching something. So as we go along life and we approach it, then we try to live a better lifestyle. Okay, it may sound like a cliche lifestyle. Ano nga bang lifestyle? Okay. So maybe for those who are approaching an older age, okay, so some exercises may not be applicable to us anymore now as they were when we were younger, but we still can do exercise, a lot of those, okay? For those in the perimenopausal age, I would recommend that you do exercise yung mga weightlifting, not the barbells, okay? Of course, there's no contraindication for that. But you can start with using dumbbells and then you increase the weight just so you can take care of your muscle mass, okay? So pwede naman po yung mga simple lang ng mga nasa bahay. You don't have to buy your dumbbells. You can use whatever, mga pail na may tubig, you can use that. That will fit your physical capacity and functionality. Okay, you can use the stairs, go up and down, just as long as you do exercises. The basic tenet of exercise as a lifestyle modification is still the same for everyone. At least 150 minutes every week. Then you can walk around. Of course, our patients will tell us, hindi ko pwedeng lumabas kasi naka-quarantine. No, you can go out. Malapit lang sa inyo. You can put your mask on. Anyway, lakad lang naman eh. It's difficult when we talk about running, and that's a different story. And then, of course, sunshine. You need your vitamin D. Nakakalimutan ng iba, no, natatakot sa araw. Bumababa po ang vitamin D as we age. And of course, with the diets, we do away with too salty, too sweet, yung general terms pa rin po, so that we will not gain weight. Because as our weight increases and sa menopause, parang ma-aggravate pa po yung symptoms natin of the menopause. Some women kasi would tend to be busy. For example, for the moms would be busy around the house. They will not be taking care of themselves. You have to take care of yourselves. Otherwise, your bone will get weak. Your muscles will get weak, and your mental health, of course, will not be optimized, and you will feel all the symptoms during menopause.
Those are very important tips. Now, I'd like to ask Dr. Cora, so with all those tips in mind, what does post-menopause look like? What can you advise the women about the post-menopause phase?
Being conscious about health should not start only during the menopausal period. As our behavior prior to the menopause, our eating habits, the way we exercise, will impact on our postmenopausal period. So this is what I tell my patients, because sometimes patients come to me with thickened abdomen and they would say, "Doc, meron yata akong bukol sa loob, lumalaki yung tiyan ko." Okay, so menopause, I said, is the time of tightness and sagging. Aside from all these skin changes that we see years after menopause, we see the enlarging abdominal girth. And so I said our lifestyle prior to menopause will impact on how we appear and how our health of our heart and bone. Okay, kung sakaling hindi sila nag-exercise prior, then yes, they have to adapt to a regimen that will help them reduce the risk of these significant changes in our life.
Very good advice, Dr. Cora, and definitely a lot that our viewers can learn, because a woman's health is our mission on this program, especially with today's topic. And we hope today's conversation was very helpful. If any of the viewers still have questions about menopause or pre-menopause, please have a conversation with your obstetrician, gynecologist, or your endocrinologist. With that, I'd like to thank our guests for joining us, obstetrician and gynecologist Dr. Maria Corazon B. De Jesus and endocrinologist Dr. Aurora Macabalog. Every woman's menopause experience is different and unique. Some go through severe symptoms, others don't. And while this may cause uncomfortable changes, these can be effectively managed. This is a transition into a new phase of life. How you deal with it makes a whole lot of difference. I'm Dr. Freddy Gomez. Join us again next time on MedTalk Health Talk, only on CNN Philippines.